The management of the Federal Medical Centre Yola has expressed satisfaction over its third successful surgical separation of conjoined twins. The Chief Medical Director of the hospital, Awwal Muhammad Abubakah, blamed the delay in surgery on the outbreak of the coronavirus pandemic. Correspondent Awwal Adenusi filed in this report.
6 conjoined twins have been successfully separated in the country. The celebrated Bayelsa conjoined twins is the third successful surgical separation carried out by the Federal Medical Centre Yola since 2013. The hospital shot into limelight in 2013 with its first operation on conjoined twins, followed by others in 2018 and 2020 respectively. The Chief Medical Director of the hospital attributes their successes to prominent roles played by the Secretary to the Federal Government of the Federation, Boss Mustafa, the Nigerian Liquefied Natural Gas Limited, and the Emeka Ofo Foundation, who donated more than equipment to the hospital. He goes down memory lane, narrating how the management of the FMC Yonugwa first contacted them for help, noting that transporting the twins became a challenge. It was then the Nigerian Air Force came to the rescue, offering to transport them to Yola for free.
Experience over the years, so we've also had a new equipment that made the division of the liver easier and faster with less blood loss. And the surgery was successfully carried out, as I said, on the 10th of August.
The SGF Boss Mustafa expressed joy over the feat recorded by the hospital, stressing that federal government would reward the hospital at the appropriate time. Governor Ahmadu Fintri believes the befitting reward will be for the federal government to convert the hospital into a specialist center dedicated to the separation of conjoined twins.
That we must, as a government and as a people, consciously begin to deal with things that matter to the people.
The medical team who carried out the operation expressed their joy at the success of the operation, as do the parents of the twins.
We've been privileged to have been able to separate Mercy and Grace this time around. And
this one will come and say, this is an abroad operation. This is an operation that will be done abroad. Me, my own self, I never knew all this kind of operation is going on in Nigeria.
It is a call to the federal and state government to do more to discourage medical tourism by expanding the health insurance scheme to cover the informal sector. Government should also increase budgetary provisions to the health sector so that many more hospitals can meet up with standard medical practices abroad.